Now, let's talk about our balance system. First off, what is balance? Well, balance essentially is our body's ability to maintain its center within its base of support. So whether we're standing on our feet, that would be our base, or if we're sitting down, where we're seated would be our base of support. So our body's balance system has three major components that work together to help us stay upright. Now they include our vision system, our sensory system, specifically in our feet and legs, and our vestibular or inner ear system. Now if any one of these systems is off, then it can negatively affect our balance as a whole, which may result in a stumble or a fall. Now a fall, as we all really know, is an unexpected event in which an individual will lose balance and come to rest perhaps on the ground, the floor, or the lower level. Now this is when that center of gravity goes beyond our base of support. Now how common are falls? Well, falls are very common if you're an older adult. 1 in 3 adults over 70 will fall every year in Canada. And falls are the leading cause of injury related to hospitalization and even death in our older adults 65 plus. And 95% of all hip fractures or broken hips are the result of a fall. Now, why do we fall? Well, there's a long list of potential reasons why people fall, specifically older adults. Some of those risk factors include dizziness, certain medications, cardiovascular issues, vision or hearing impairments, pain, poor functional strength, like getting on and off the floor, or slow walking, or difficulty getting up from a seated position, and environmental hazards, to name a few. Of course, there's many more in that list, but those are some of the key risk factors. Now, one of the key questions is, what's your risk of falling? Well, there's 3 questions you can ask yourself to see if you're at an elevated risk of falls. One would be, have you fallen over this last year? If the answer is yes, then that will slightly elevate your risk of falling again. Number 2, do you feel unsteady when you're walking or standing? Again, if you answer yes, then that may elevate your risk of falls. And finally, number 3, are you worried about falling? When we're worried about falling, that also elevates our risk of falling again. All right, now a physiotherapist can use specific tests to assess your risk of falls, including they can measure your gait speed or how quickly you walk. And there's a specific cutoff score for your gait speed, and there's another test called the timed up and go, and that just measures how quickly you're able to get up from a seated position, walk 3 meters, return, and sit down again. So ultimately, you are at low risk of falling if you haven't had a fall in the last year, if you have a reasonably normal walking speed, and your functional strength is good. Now you may have an elevated or an intermediate risk of falling if you've had 1 to 2 falls in the last year, but you haven't injured yourself. You wouldn't be considered frail. You're able to get off the floor, but perhaps your walking speed is a little slower than normal and maybe you have some functional weakness. And finally, you would be at high risk of falling if you've had over 2 falls this last year, resulting in an injury, or perhaps you're deemed frail, not able to get on and off the floor, and perhaps you've lost consciousness when you have had a fall in the past. All right, so what are the typical signs and symptoms of poor balance and potential falls risk? Now, like I've mentioned, a previous fall would put you in that category of a typical sign and symptom. Or if you've been advised to use a cane or a walker, if you are afraid of falling or feeling unsteady, if you notice you're grabbing furniture or walls when you're walking around your home perhaps in order to keep your balance, maybe you have difficulty rising from a chair without the use of hands, slow walking speed, as mentioned before, or difficulty stepping onto a curb, that's certainly a symptom. Difficulty or inability to get on and off the floor. often rushing to the toilet. Now this can be something, especially if you're getting up at nighttime to use the bathroom or throughout the day and you really need to get there rather quickly, that can be a risk of falling, and it could be a sign or symptom that you may have a fall. If you have vision or hearing loss, if you notice that you do get dizzy or you have something called orthostatic hypotension where your blood pressure changes when you change position, or if you have some loss of sensation in your feet. And finally, if you're taking medications that sometimes make you feel lightheaded or sleepy, or medications that help you sleep or to improve your mood, or if you often feel sad or depressed. These are some of the key kind of signs and symptoms that may indicate that elevated risk of falling. Now, some of these risk factors that we've talked about are modifiable, meaning we can make improvements, we can make changes. For instance, evidence has shown that older adults can improve their balance, their leg strength, and functional mobility through consistent and progressive exercise training. And they can also learn strategies to improve urinary symptoms or manage cardiovascular symptoms. And exercise and other therapies can also improve mood and depression symptoms. So there are things that we can change. Of course, there's some things we can't change, but let's do what we can to change the things we can. It's so important to remember that progress is possible. Even if you've experienced a fall in the past, or you have an elevated falls risk, or you're simply concerned about your balance in the coming years, you can do something. So the key really is going to be proper exercise and lifestyle choices. Now, have you ever noticed that as you age, you need to work a little harder to keep your physical capacity? It's a little bit more of an uphill battle, right? But it's doable. The myth that you can maintain what you have by doing the same thing you've always done is just that. It's a myth. The ultimate truth is that maintaining the status quo will lead to decline. So if you do nothing, your balance will continue to deteriorate and your likelihood of falling will increase. So do something. All right, now that we know a little bit more about balance and falls risks, in the next video, let's talk a bit more about the specifics of what we can do about it.